he ended up getting very addicted, and he ended up moving from those prescription opioids to heroin, which is something that happens to many of our veterans in this situation, as well as many Americans. 40% of those 130 people who die every day start through prescription drugs. Cliff came back from that dark place that he went to in his life, and I met him at an opioid recovery center where he was to prevent them from having to go through what he went through. We just got a call about a week ago from Cliff's family that he passed away because of an opioid overdose. Very real consequences to the inaction, to the lack of solutions, to the real focus on truly solving problems like this. There are so many more heartbreaking stories I could share with you for those who are suffering because of our greed-driven healthcare system, for those who are struggling, both families as well as individuals, because of our broken criminal justice system and our failed war on drugs. So many people suffering in many different parts of our country because ultimately you have a situation where leaders in Washington are thriving off of this pay-to-play culture where they're making decisions based on what is most going to benefit their lobbyist friends or the PACs who write them checks and give them money, rather than coming together as Americans, Democrats and Republicans, saying, we gotta take action now. We have to work together. We have to work together to solve these problems and not be worried about who gets the credit. Not be worried about, well, hey, if I work with this person on this issue, it's going to make them look good and make it harder to beat that person in the next election. But sadly, this is what we're experiencing. We passed recently, actually a few months ago, a bill called the First Step Act, which brought about some really important prison reforms to help reduce recidivism rates and to help best rehabilitate and equip people who are incarcerated to go back into society and their families and contribute and not continue in this revolving door of our broken criminal justice system. It was not an easy bill to pass. You had a progressive and a conservative who worked very closely together to lead the charge, but both of them were attacked and criticized heavily from people in both parties for different reasons. But most of those reasons were based on politics. And so the biggest hurdle that ultimately had to be overcome actually came from people in my party, in the Democratic Party, who have been fighting and calling for criminal justice reform for a long time. And the reason for that obstacle was, if we push through this legislation through the House and the Senate, it's going to make Donald Trump look good. And he'll be able to go around the country saying, look what I did, look what I accomplished for all of these individuals. So let's just wait. Let's just wait until Donald Trump is out of office, and then let's go and pass the legislation. Meanwhile, thousands of people who would otherwise be released, otherwise return to their children and their families, just let them rot away in prison for a few more years because we don't want Trump to have a good thing to say. This is what I'm talking about. Since that legislation passed and was signed into law, 7,000 people are now home with their families where they would not have been otherwise. So I want to wrap this up so we can get to questions and answers, but I just want to illustrate to you what I'm talking about here. The cost and consequence of continuing with the same old versus the opportunity of what we can accomplish when we stand together, when we work side by side as Americans, understanding and knowing we can accomplish anything. None of it will be easy. There are great obstacles, people who are making a lot of money, people whose power depends on on a continuation of the very few people in Washington saying, hey, we know what's best for the country, not you. But as history shows us, it is only we, the people, who have the power to bring about this systemic change that we need to see. Of respect and integrity and honor and service to the White House, treating every single American with respect, and inviting all Americans to join our efforts to make this change, to provide your input, to hear your perspective, so that we can get to a place in this country where we can actually start solving problems, and where we can have the confidence that those who will come after us, our kids and their kids and their kids, will have better opportunities and a brighter future. Thank you very much, all of you, for being here today. Thank you. Thank you so much. Thank you. Thank you very, very much. Thank you. So as we can, so I'll just ask you if you can be a little bit brief. I will also try to be brief, so we can get the conversation going. Did you want to start? All right.
You're the first candidate I've ever asked any questions of.
Awesome.
So
I'm honored.
I'm slow.
You're good. What's your name?
Lorraine.
Thanks for being here, Lorraine.
Sure. How would you change things for, here's a situation. A close friend of my family was recently, on January 31st, diagnosed with a brain tumor. And he was sent home because he didn't have the insurance to cover the biopsy and such. And so then he was told to quit his job, to apply for Medicaid, so he would be able to get his life saved, but yet then he has no income. And the entire family, I helped them with phone calls, with paperwork, with getting things transferred. They got to spend the next 2 weeks just trying to go through the logistics of the healthcare side of it, rather than help their son. What would you be able to do to bring changes like that? He's 27. He just turned 27. So that's what the whole family's been dealing with, rather than just be there and find out what kind of tumor it is, that kind of stuff.
And get him the care that he needs.
Yes. So how would
Thank
you be able to change that?
In America, we are the most prosperous nation in the world, with the most opportunity and the most advanced medicine. Yet a 27-year-old man is not able to get the care that he needs, nor is his family able to have the peace of mind that they deserve, to know that in this time of such urgent need, he'll be able to see the best doctors and to be able to get the best care without having to worry about, is he going to have to be homeless, or where is he going to live because he can't have his job anymore? This is the product of a greed-driven healthcare system that's not actually interested in providing quality healthcare to people. You have big insurance who's in the business to make as much money as they can, and therefore figure out how they can pay out the least amount of money. Did he have insurance?
No, he couldn't afford it.
He didn't have insurance. Like most Americans, having require and focus it on a true healthcare system. I've done a lot of research about this. Every other developed country in the world has figured out how to provide their people with the peace of mind that they don't have to worry about whether they can get health care when they need it. So this is not an impossible task, nor is it a partisan one. This is impacting families and individuals regardless of what party they are affiliated with. This is something that hits close to home. If your friend had a good insurance plan that he was very happy with and he was getting the care that he needed, then he would obviously be able to continue to keep that. Or if his family was able to purchase a supplementary plan that worked best for their family, then that would of course be on the table. The bottom line is making sure that we have the freedom of choice to determine what works best for us or our loved ones or our family, but not in any way undermining or taking away from the ability for us as a country to guarantee quality health care to all Americans. Number one. Number two, by doing so, and working with Congress, lifting the prohibition that currently exists that does not allow Medicare to negotiate lower prescription drug prices with big pharma. Taking big insurance greed and big pharma greed and saying, no, this is not how we do things anymore. You don't get to have a seat at the table where we're forming the policies to make sure that our laws as it pertains to healthcare are actually focused on the delivery of that care. We are the largest purchaser of prescription drugs in the world. Our government, the largest purchaser of prescription drugs in the world. So you can imagine why Big Pharma spends more money on lobbyists and PACs than they do on anything else in their industry by far, so that they can fight to keep these laws on the books that exist now, that prohibit us from negotiating those lower prescription drug prices. Because we have a tremendous amount of leverage. As the number one customer, we must be able to negotiate those lower prescription drug prices. We must be able to allow people to re-import these same drugs that people need, whether it's insulin or other things, from places like Canada, where they can get them at a fraction of the price that they can get them here at home. The third thing I'll mention, it's a little bit more of a broader point that doesn't necessarily directly impact your friends, but I think it's important as we talk about going from a sick care system to a health care system, that we dedicate resources towards prevention and wellness, integrative care, holistic care, alternative forms of treatment, nutrition. Did I mention nutrition? So we can actually try to prevent more people from being sick and have a result of a healthier country. And oh, by the way, would drastically reduce what we spend on healthcare in this country. Taking a comprehensive look, focused on the objective of healthcare, rather than kowtowing to the big corporations who are continuing to make incredible profits off the backs of people like your friends. Yes, sir.
There you go. She's got a mic for you.
I spent the better part of me for a question that's a little bit more kind of obscure. I spent the better part of the 2010s being very, very anxious, to the point of almost taking my life several times and stuff like that. And I never actually tried it, but I was in that point. And I had a very, very close friend. I started this new decade in a very good state.
Good.
But I found out on January 1st that one of my closest friends and a girl that could just absolutely light up a room took her own life for whatever reason. And it's really blindsided our community. I live south of Denver, but it's really been hard to deal with, and trying to figure out why and everything like that. Now, my question is I don't know what kind of psychiatric treatment she was receiving, but I bounced around from psychiatrist to psychiatrist to psychiatrist to psychiatrist for the longest time, and now I've been on the same one for like 3 or 4 years or something like that, and he's done great. But it seems like so many people so many psychiatrists just simply do not understand how to best deal with it. And also, when I was going through my issues, I felt very much kind of like a stigma. I really didn't want anybody to know what I was going through, because that would make me less of a man or whatever. And so my question is just really, it's such a delicate balance, because obviously the government can't go find every person that is suffering like that, but how can we maybe have a little bit of checks and balances on psychiatrists, psychiatric care, and if somebody isn't willing to receive psychiatric care, maybe trying to nudge them a little bit in that direction. I'm sorry for my question.
No. It's don't apologize. Okay. It's a very and it's not an obscure question. Okay. It's not an obscure question. I can guarantee you there are people in this room who've had similar struggles as you. So where we need to start is with lifting this stigma away from those who are seeking mental health care and those who are not seeking it because they're afraid of the things that you've talked about. Unfortunately, this still exists in a very powerful way in the military, where we're still seeing a high number of veterans, 22 veterans every day taking their own lives. And it still exists in this country where, as you said, people will judge you or look at you differently, or maybe you won't be able to get the job that you need because somebody might find out about it. And so as we're talking about healthcare, recognizing that healthcare is not limited to physical health, it includes mental health. Our well-being is dependent on both of those things working as we need them to. They are very much intertwined. And so just as I talked about taking a holistic approach to healthcare, that includes taking that holistic approach to mental health. Because I don't know what your experience specifically has been with psychiatrists, but I know of those people I know personally who have gotten through that first big hurdle and barrier to actually go and seek care. And when they get it, all they're given are drugs to take to numb the pain, so they don't actually feel the anxiety, or they don't, are forgetting about the thing that was causing the anxiety, or whatever it is. It's just, well, here's some more drugs. All right, now you're fine. Go about your business and live in this kind of numbed dream state of mind, which is not actually helping this person at all. And I think that's kind of about here, is having those who are mental health professionals who are, again, not lost everything, now 4 years sober, in recovery. He's taking care of other people who've gone through the same experience, that same thing. There's no one-size-fits-all approach. What our role can be and should be is to ensure that there is access, ease of access and availability for those mental health professionals, and those many different modalities of treatment and the resources to back it up. This is something especially, do we have any teachers here today? Teachers? Thank you. Thank you for teaching. But I've heard from a lot of teachers that, especially in the classroom and with kids, we not only have a growing need for school counselors and mental health counselors here in schools, but also because of this opioid epidemic, we're seeing children of those who have fallen victim of this epidemic now going to school with a whole new set of trauma that those working in our schools are grappling with. How do we best provide care and education for these kids? So, thank you. I'm gonna go here. Yes, ma'am, in the back. Oh. Well, I'll take both of you.
So I believe the children are the future, and my grandfather and grandmother were both teachers for 50 years. They believe they've seen a decline in children's curiosity and what they called, just glazed over. Kids are not interested. And we are also declining in our rank in the world for education. Oh, I'm sorry. We're declining in the world for our rank in education, and I was wondering, how do we invest in our education, and how do we invigorate our education system so that we are no longer falling behind?
Great, thank you. Do you want to tag along on that, or you have something totally different?
It's sort of related.
Okay.
My question was a little bit more general. When you spoke of the country that stands against itself cannot stand, we live in an increasingly divisive world where it's profitable to be sensational and radicalized on the media. And my question was, how do you plan to move forward in a progressive way while also unifying the country in regards to education and gun safety and addressing climate change and all of these huge issues that people are already so polarized about.
Yeah.
Thank you. You're right. These are both very connected. I'll get into the details about education specifically, but the way that we bring about this change is not to say, well, I'm only going to focus on quote unquote progressive change and I'm not interested in conservative change. It's getting away from these polarizing labels that are pitting us one against the other and standing in the way of us even having a numerous times where once you get past that, where if you don't even go there, you don't even talk about this, but instead you really focus on what you brought up. We have families all across the country, regardless of political background or views, uniformly, people want their kids to get a quality education, to be able to have great opportunity, to be able to do well in whatever they choose to do in their lives. Talk about climate change. Instead of using the words climate change, let's talk about our environment. Let's talk about clean water and clean air, these beautiful places that we get to call home. Focusing on things that brings about the kind of change, not polarizing, but is instead unifying. Now you're right. Clicks, people put tweets out and be as divisive as possible, as radical as possible to get as many retweets as possible. You see how the corporate media, what they choose to put on TV, the kinds of voices that they're raising up, it's for the ratings and it's for the views. Well, this is again, how we are choosing to set the tone and the culture for our country. We can either play into those hands and respond and fall into that trap, or we can respond in a way that Dr. Martin Luther King showed us how to do. To not fight hate with, not fight that divisiveness, but instead with light. And that being the only way that we can make progress and unite as a country. With education, for example, we have, and again, teachers here, I've heard from so many teachers incredible frustration that you have laws being passed and policies being made in Washington, even with good education. They have no idea what it would look like to really execute these plans in a way that helps us achieve the objective of making sure our kids are walking out with the knowledge and experience and understanding that we all want them to have in order to compete in this ever-shrinking global economy. So to me, the answers are how we bring about the change. Number one, I would appoint a Secretary of Education who's been a teacher, who's been an educator. I think it's pretty important. Leadership matters, experience matters. And for teachers to know that someone who was leading the Department of Education has literally walked in your shoes in the classroom, I think will have a direct impact on breaking down those barriers that exist between the classroom and the massive bureaucracy in Washington. The second thing I would do is I would gather and invite a council of teachers from all different parts of the country to come together and advise on what reforms are necessary for our education system. So that, again, even those with good intentions don't end up creating problems with unintended negative consequences and can better understand the experiences of families and teachers and kids that vary greatly from one part of the country to another. Coming together and saying, what's our goal? We share the same goal. We share the same objective. We can figure out how best the federal government can play a role in ensuring that there is equity in the education that our kids are receiving, no matter what zip code they happen to be born in, but also that